my interest in hemostasis and thrombosis is very much around how these things will change when a patient is infected or when a patient is very unwell in the intensive care unit. So normally, when we discuss mechanisms in hemostasis and thrombosis, people think of a patient who is bleeding, or they might think of a patient who has thrombosis, which is a clot in their blood vessels. We have good treatments for either of those conditions, and that is what I do clinically. What we are more interested in the research lab in Liverpool is the middle bit. There are some patients who will bleed and thrombose at the same time. So as you can imagine, this is very difficult, because if you treat the bleeding with something to promote clot formation, they will overthrombose and vice versa. So as I explained, that these unusual scenarios are typically when patients are not well. So there's an aberration in how they form clots, so aberration in how they stop bleeding. So it's a challenging area, but these days with the technology that is well advanced, I'm sure we can find something that can both, stop the bleeding, but also prevent overclotting in the small blood vessels in the body. Probably there are molecules in the pipeline, and possibly there are molecules out there that have been used in other circumstances that haven't been tried in this particular area. If we are starting from scratch, it will be a long process, but potentially by disseminating the work we have done on understanding the mechanisms of the IC, people out there, companies out there who may have molecules that could be of relevance to test in this area could actually transform care quite quickly.